The risks run high with brain aneurysms, ranging from brain damage to death. Yet people are misdiagnosed every day, leading to catastrophic consequences. Therefore, it's vital that we always consider a brain aneurysm in one's differential diagnostic circumstances when common symptoms are present, and then recognize the possible existence of a brain aneurysm in order to initiate emergency treatment immediately. Over the next several minutes, we will hear from medical professionals, survivors, and caregivers. They will share their expertise, their stories of tragedy and survival, and their passion for promoting early detection of brain aneurysms. We hope that by hearing from these dedicated individuals, you will gain expanded knowledge of early detection and therefore better serve your patients and loved ones. And the life you save could actually be your own.
The Brain Aneurysm Foundation mission includes many things: support, education, awareness, and research funding. And now with early detection being one of our primary goals and targets going forward, I just want to thank everyone for being a part of this. I ask everyone who watches this video to please share it, get the word out, raise awareness, and save a life.
A brain aneurysm is an outpouching, a weak spot, or a bubble on the artery in the brain. It tends to occur where arteries divide, and there's an inherent weakness which can increase over time to the point where it gets so weak that it ruptures or breaks, causing an intracranial hemorrhage.
Risk factors for an aneurysm are very similar to cardiovascular disease. So it would be smoking, high blood pressure, certain medications. It affects women more than men, and it also affects African American more than Caucasian.
Brain aneurysms are a very serious event. When they rupture, up to 40% of patients will lose their life. We try as hard as we can to identify them early and treat them as rapidly as possible.
There are 30,000 ruptures every year. 15% of people die. They don't even make it to the hospital. The problem is there is still a large number of patients who are misdiagnosed.
Headaches are very common, and most patients who rupture a brain aneurysm will complain of very severe headaches. Because headaches are common, many physicians and providers will confuse a symptom of a headache and not consider brain aneurysm in the diagnosis.
Patients will go to an emergency room with a severe headache, neck pain, and oftentimes sent home because they feel it's maybe the flu, maybe anxiety, maybe stress. And this is a big problem because then they will go home and oftentimes never make it back. They will die.
If we miss that opportunity to get that patient quickly to the hospital because we make an incorrect diagnosis or we assume that it's a more benign syndrome such as a migraine headache rather than looking at it as a potential brain aneurysm, we can really worsen those patients' outcomes.
We're almost like detectives in the field, and we have to look around and be aware of our scene and look for medications and walk in and have that 30,000-foot view, because if we don't have that, we will miss things.
Early detection is the key to trying to achieve good outcomes from treatment. The better condition that a patient is in when this diagnosis is made, the better chance they have of doing well. When aneurysms rupture, they can cause coma, they can cause serious deficits, and we can get patients through those problems, but it's much more difficult to obtain or achieve a good outcome. So early detection is, in fact, the cornerstone of preventing that kind of problem.
I guess the story really started just a little over 10 years ago, August 4th, 2005. Cheryl and I were sitting up one night. It was around 11 o'clock at night, getting ready for bed when Cheryl just out of the blue, out of nowhere, just kind of grabbed at her right
side,
eye.
the worst headache.
And just yelled and said, I think her words were, "Oh my God, something's wrong." I called 911. Cheryl was basically unconscious on the floor. The paramedics took her out, had her in the ambulance. We live about 7-8 miles from a major hospital, Rhode Island Hospital, which has a major trauma center. And I asked them if they were taking her down to Rhode Island, and the paramedics said no, they were taking her to the local hospital here in North Attleboro. When I arrived there, 10 or 15 minutes later, went in the emergency room asking, where my wife was, and I remember having 5 or 6 people looking at me with very blank looks on their face saying that nobody had been brought in. And I said, yeah, her name was Cheryl Campbell. She just came in by ambulance. They got on the phone to the fire department, and the fire department said no, that they had been redirected down to Rhode Island Hospital. So I back out in the car and headed down to Rhode Island Hospital. I went in, told them who I was. Some nurses came out, had me take a seat. I believe they had a social worker at that point come out, which is obviously when you know that something really significant is going on. And probably within an hour or so, they said they had to take her in for surgery. She had some bleeding on the brain. She made it through her first surgery that night, several hours of surgery. The doctor, I remember, came out and said that they went in, they had removed the bone plate. The bleeding had stopped, but they were unable to find the cause of the bleeding. So they brought her up to neuro ICU, and over the next several days ran a whole battery of various tests on her. And it was probably 4 or 5 days later, one of the tests, the MRI, showed a very, very small aneurysm, but they didn't think that was the cause because it was so small. So back into surgery, her second surgery in the brain in a matter of a few days. So sitting in the waiting room, I remember the surgeon coming back out, the same surgeon again, and telling me that it was the aneurysm. The reason it read so small, it was a kind of a unique aneurysm, which was a little more challenging for him to fix surgically, but he was able to put a clip on it, and I'll never forget his words that night, is that I've repaired it as best I could. And I remember that wasn't very comforting at the time.
I rely on a lot of people, and that's one thing that is hard for me. But to get me to the point that I'm at has been the support of family members and friends. And that's what's carried me through to this point of being a 10-year survivor.
Mm-hmm. And our 30th wedding anniversary was just a month ago, which we celebrated at our daughter's wedding.
And that was a great occasion, and I was here to see that all. Still to this day, there's always a challenge, but I have to just tell myself to fight forward, to step forward and keep on going. You can do this, Cheryl. And that's why I'm here.
I think Cheryl's situation highlights the whole issue of early detection and considering the diagnosis. Once that diagnosis was considered, a simple scan was obtained, and within minutes, the diagnosis was known. And then she could be mobilized to centers where she would be treated appropriately and in fact have a good outcome if treated appropriately and early. So her case highlights this issue of consider the diagnosis, think subarachnoid hemorrhage if you're a physician or even a family member, and then rapid evaluation of that problem.
Mark was a big guy, was an athlete, maybe 6'6", played college-level basketball at Marquette University, drafted by the Knicks, that kind of guy. He was on a golf trip out in Arizona, flew back from Arizona on a Thursday, and fell asleep on the plane. And as is the case with a lot of big guys when they fall asleep, he got a kink in his neck. And he woke up and he was in a lot of pain. And he thought it was because he just fell asleep awkwardly. Well, turns out it was a lot more than that. So that was on a Thursday, and on a Saturday he was really feeling awful. Went to one of those walk-in clinics and thought at that point in time he had an earache. The clinician looked at him and said he didn't have an earache and sent him on his way. He had a series of events throughout that weekend. Mark was a popular, very engaged guy. His son had a birthday party, and Mark was always the life of the party and could stay up past anybody. Well, on Sunday, he wanted to go home early. He didn't feel very good. I saw him at the gym on Monday morning, and he was telling me about his pain. He's like, "Man, I think I got a frickin' brain tumor. It's unbelievable, this pain." And he's laughing about it. That was the last conversation I had with my great friend Mark Murata. 2 days later, he was back in the gym, and he had to take a conference call. So went out to the car, and it was an international call. People were on the phone from all over the world. And they heard this great moan, this terrible sound. So it was so bad that the moderator stopped the call and did a roll call. Well, at the end of that, they got to Mark's name, and there was no sound, and he had collapsed in his car at that point in time.
He did not need to die. I think we can learn that we need to be careful to get proper history on patients when we see them and to get the proper studies. And I think one of the most common reasons for misdiagnosis is not only not getting the full history, but also the proper test is not done.
My husband and I were packing our car, getting ready to leave to take our children to Busch Gardens. And all of a sudden it felt as if I were shot in the head. I could feel it just right exactly where it happened, right behind my left eye. I did not lose consciousness though. I remember every detail. I remember the pain. It was like the worst headache of my life. It was like a bullet or lightning bolt in my head, and immediately felt a lot of pain and pressure down the back of my neck, all the way down my back, all the way down to my feet, and was just really stiff and could barely move. I was scared to move. The paramedics came into our room and had me lay on our bed and did all of the procedures, checking my blood pressure, which was sky high, asking me questions, loaded me up and proceeded to take me to the hospital. And on the way to the hospital, I noticed that they were stopping at every red light and were not in a hurry. The siren was not on. And I asked the guy that was in the back with me, why are you stopping? It hurts so bad every time he touches the brakes, And he said, well, we, something along the lines of, we generally only run lights and are in a hurry and run the siren when it's a life and death situation. I think maybe because I was young, I was only 35 and healthy, and they just didn't consider that it could have been an aneurysm. When we got to the hospital, they began giving me pain medications and doing scans to try to pinpoint exactly what was going on. I remember finding out that it was an aneurysm and actually learning what an aneurysm was. I had no idea. And kind of fading in and out from consciousness because of the pain medication. Remembering my family all visiting me in the emergency room. And I could tell each family member that came to visit me that how grim the look was on their face. I think that they thought that they were probably seeing me for the last time. But yet, in the back of my mind, I thought, well, you guys are crazy. I'm going to make it through this. I knew I was going to be okay. But from what I was told, I had a 6-hour surgery, craniotomy, where they went in and clipped the aneurysm. It happened to be intertwined with my left optic nerve. So I'm very fortunate to still have sight in that eye. But the surgery was a success. It went smoothly. 6 hours, I think they ended at about 10 o'clock that night and kept me under anesthesia overnight.
At this point, I would say that, not having all of the information, not being there, one of the bigger takeaways was, did they assess the patient? Did they have a true understanding of the emergency that was there? And then the fact that they were educated afterwards, and the whole municipality or service actually was educated on this patient's outcome, is how we do better in EMS. We have to take the cases, we do rounds to discuss these important cases, and when the outcomes are great, we celebrate the success. But when there's something that we could do better, just because the outcome was great, we use those as key learnings, and I think that's probably one of the biggest takeaways, that they did really well in that case after the fact.
About 10:30 at night, I was sitting around the house, and all of a sudden I just got this severe pain through my head. Bob was sleeping, and it just felt like a searing pain that went like from the front or the back, just straight back. It was like a searing hot pain. I also had the like projectile vomiting, and I started getting hot and sweaty, and I had grabbed some ice out of my drink and put it on my neck, and it just made me fall to my knees. And I ended up on the couch the whole night, and that was a Thursday, and I didn't go to work on Friday. And I thought I had the flu. So I went to work finally on Monday, still not thinking anything other than the flu and maybe some weird migraine. Tuesday I went to work, and I finally decided to call the doctors. And I went to see my nurse practitioner and told her all the symptoms, that I had excruciating pain in my head. I was having some weird pains down the back of my hips and my legs. It was like a burning. She gave me a shot of Toradol and sent me home. During the middle of the night, that was Tuesday, it ruptured a second time. And I just sat up in a lot of pain, and then I just went back to sleep. I didn't want to wake my husband up because he had the flu. So Wednesday I went back to the doctor's office, and I actually saw a different doctor. He wanted to admit me, but he didn't know what for. And when he called the hospital, they said he couldn't, because he couldn't come up with whatever it was. And he said, if you want to be admitted, go to the emergency room. So I did. My husband dropped me off. I told him to go home. And I ended up in the emergency room for about 6 hours before a nurse had told my doctor that I had a slight fever. So he came in and did a spinal. And that's when, and I remember to this day, he said, well, I wasn't expecting that. And I asked him what, and he said there was blood in the fluid. Well, all of a sudden, they were sending me to CAT scan. When I was done with that, they told me I was going to Boston. I still don't recall hearing the words.
At this point, we realized something serious was going on. That the doctor informed me that because when they did the CAT scan of the lower body and they found no internal bleeding, that time was of the essence, and if she was bleeding somewhere in the head, that her best bet was for him to get her to Mass General, because only there would they be able to have taken care of her. And it was there that everything, boom, 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 started taking place, and they were able to get her in to do the head exam. It was there when the doctor brought me in, and he brought up the pictures on the thing, and he didn't even have to point them out. It was quite obvious that I saw both the aneurysms. That's how big they were.
I had the surgery December 5th, and I was in the hospital till about December 17th. And then I was able to go home. I had a craniotomy, they clipped it. And that's pretty much how it went.
Well, she identified a headache, and she passed on seeking medical advice for that headache. That's fine, But when she provided that information to her physician's office, it would have been better to have the physician see the patient right away or send immediately to the emergency room for an evaluation.
As I was getting out of the shower, I felt as though my whole body felt like it was in a vice. And when I got out, I could barely wrap a thin, lightweight towel around my head. I couldn't even dry off. I went to my bedroom and just laid on the bed, hoping that my headache would go away. I knew something was wrong, but I didn't know what. I had to call my sister and tell her that I couldn't make it. And she told me, by the sound of my voice, that if I didn't call my husband, she would. So I was lucky enough that I knew how to call. He got home and called 911. And they were there within 5 minutes.
Yeah, when we got to the hospital, they just had her checked out. They said, we have to get rid of her headache. That's the main issue at first. And I said, well, you know, what's causing it? I said, her brother had a brain aneurysm years before. Is it something like that? Well, we got to get rid of the headache first. So then they continued on working with her.
They gave me at least 4 doses of morphine and 2 doses of Dilaudid before my headache was somewhat gone. And so later on in the day, they did a CAT scan, and it didn't show that I had 2 brain aneurysms and that one of them had ruptured. Later on, they released me and gave him a prescription for Furosec and sent me home. So he brought me home, and I never really woke up all night long. The next morning, he woke me up about 8:30 and asked if I still had a headache. And I said yes, I guess, and he brought me back up to the hospital. Seeing where he didn't call 911 to get me there, we sat in a bed in the ER till 12:30, 1 o'clock, because they were short-staffed. And so eventually that day, they got a hold of the neurology department and asked about having a lumbar puncture. And they did one early afternoon, and it showed that I had blood in my spinal column. And then everything happened really fast, and I was airlifted to Boston. And my neurosurgeon told my husband that if it would have taken them another day, then I wouldn't have made it.
Well, leading up to getting to the hospital, the husband recognized the severity of the symptoms, alerted the EMTs. The EMTs understood the severity of it, alerted the hospital. But for us in EMS, part of our role once we get to the hospital, we don't end our job. It's really about patient advocacy. So understanding the pieces that we were able to see at home, and that's a component that the hospital doesn't always get. And by making sure the hospital understands that this was a sudden onset, this wasn't gradual, there's a family history here of brain aneurysm, and being an advocate for our patient, making sure the hospital understands that we are seriously considering brain aneurysm here. Now, we know our advocacy only goes so far, but we really need to make sure that we've communicated all that information well. We've put all of that in our patient care report, so when they get sent to the hospital has all of our objective and subjective findings that suggest brain aneurysm.
I've heard story after story of young people who present with headaches, go to a local clinic, and are sent home. So I think one of the key points I'd like is for the general public to be aware of the signs and symptoms of a brain aneurysm. I really feel that if people are aware of the signs and symptoms, these deaths don't have to occur.
Brain aneurysms can occur in anyone. They're present in about 3% to 5% of the population. Many of them go undetected, and patients may never have a problem with them. However, if one thinks of the diagnosis, then fairly simple tests can be done to prove whether indeed an aneurysm is present or not. And that can prevent potential catastrophe down the road.
The Brain Aneurysm Foundation and I would like to thank the survivors and caregivers for sharing their stories with us. We also like to thank the medical professionals for sharing their expertise regarding brain aneurysms and the importance of early detection. And we'd like to thank you for your interest in learning more about this issue and for the passionate care that you provide to others. We sincerely hope that you will gain the expanded knowledge around brain aneurysms and that you will help save lives. For more information on this issue, please visit www.bafound.org.